There's not one strategy that's going to completely eliminate risk, but using multiple strategies can reduce the risk for everyone that's attending. Some of the things that are recommended are trying to limit the size of the camp as much as possible, or cohorting kids so that it's a smaller group of kids, maybe with one camp counselor or supervisor, rather than having large groups of kids mixing together. Testing prior to attending camp, 1 to 3 days before camp starts, is another strategy that can help reduce the risk of someone coming to the camp who's infected and going to transmit to others. And certainly if anyone is feeling ill or having symptoms in any way, they should not be attending. The great thing about summer camps, most of the activities happen outdoors, and we know that outdoors presents much lower risk of transmission, and so that's kind of one good thing that's working in their favor. But especially in indoor settings, masking is encouraged, as well as adhering to the physical distancing recommendations to further reduce the risk of transmission. Certain things in camps can pose more high-risk settings. Those include eating meals together, and those are especially times where people really need to adhere to the physical distancing recommendations, especially since you can't be masked, obviously, while you're eating. And so some additional kind of supervision and education for kids around those times is going to be really important. And then keeping most activities to the outdoors as possible is also kind of one of the other recommended strategies. We know that some kids have really struggled this past year with mental health issues, feelings of isolation, anxiety, depression, and certainly for them being able to return to an activity like going to a summer camp, if that's something that they really enjoyed in the past, may make a big difference to their well-being over the summer.